Hello, my name is Angelica Catherine. I'm a P4 from Drake University, and today I'm just going to be talking about carbapenem. And I'll start by just giving a brief background of the class in general, and then move towards discussing resistance. And then just to note, this presentation is just based off my own opinions, based off of the references that I've listed at the end of this slideshow. Then first, we're just going to talk about the mechanism of action. So carbapenems inhibit the bacterial cell wall synthesis by binding to this penicillin binding protein. And then this blocks peptidoglycan synthesis in the cell wall, and it results in the bacteria to lyse. And then for coverage, as you can see, carbapenems are a pretty broad spectrum, with imipenem, doripenem, and meropenem covering most gram-positive and gram-negative bacteria. It is important to note, though, that these medications aren't active against MRSA or atypicals, but they do have ESBL coverage, unlike other beta-lactams. And this is just because ESBL-producing organisms don't hydrolyze carbapenems unlike other beta-lactams. And then ertapenem is the exception, as it doesn't cover Enterococcus or Pseudomonas. And then moving more towards class information, an important drug interaction to know is that carbapenems interact with valproate products, since carbapenems decrease the concentration of valproate. And then as a result, it's not recommended that these two agents are used together, but if a carbapenem needs to be used, because it's the only antibiotic that will cover the organism, an additional anti-seizure medication should be added. And then as for side effects, carbapenems can cause diarrhea. Since they're so wide spectrum, they can kill the good gut flora. And then they also can cause seizures at higher doses, because they can act as GABA receptor antagonists and NMDA receptor agonists, which essentially overstimulates the brain. And then seizures are more common with imipenem and cilastatin, and at higher doses, and if you fail to renal adjust, if somebody has renal dysfunction. And they can also suppress bone marrow and then increase LFTs. And then as for monitoring, since these medications are renally dosed, it's important to monitor renal function. And then you should also monitor LFTs, since the medication can increase LFTs. And then CBC, just to make sure that the infection is improving and make sure there are any abnormalities. And then next, something interesting to note with carbapenems is that they're contraindicated in patients who had an anaphylactic reaction to beta-lactams. And then as you can see, just by looking at the structures, carbapenems and penicillins have different structures. So that's kind of why the cross-reactivity between penicillins is pretty low. It's less than 1% in patients who have a positive penicillin skin test. And then this is similar for all carbapenems. There's not one carbapenem where you're more likely to be allergic if you're allergic to penicillin. And then similarly, carbapenems have a lower incidence of allergy. So it's less than 1%, and rash is most common. It's super rare to have an anaphylactic reaction to a carbapenem. Then next, we'll transition more towards resistance, so carbapenemase resistant Enterobacteriaceae. And this is just defined as bacteria that are both non-susceptible to at least one imipenem, meropenem, or doripenem, and they have to be resistant to ceftriaxone, cefotaxime, and ceftazidime. And then just a note, Enterobacteriaceae is a large family of gram-negative bacteria. And then CRE incidence is rising, and most of these infections do occur in healthcare facilities, and they have a high mortality associated with them. And these infections usually appear as UTIs, bacteremia, pneumonia, etc. And then the mechanism for this is that there's a production of carbapenemase, which hydrolyzes the beta-lactam ring in the carbapenem and it inactivates it. Then next I'll talk about meropenem vaborbactam, which is an agent that is effective against CRE, and it's currently FDA approved for complicated UTIs, including pyelonephritis. And then it contains vaborbactam, which doesn't have any antibacterial activity, but it protects meropenem from degradation. And then I've listed the common dosing below. And then while meropenem vaborbactam is only approved for UTIs right now, there are studies for additional uses. So this Tango 2 trial was a phase 3 trial that evaluated the safety and efficacy of meropenem vaborbactam monotherapy versus current best available therapy for CRE. And then current best available therapy right now includes either monotherapy or combination therapy with polymyxins, carbapenem, aminoglycosides, tigecycline, or ceftazidime, avibactam alone. And then for the results, it was found that monotherapy with meropenem and vaborbactam for CRE was more effective compared to traditional therapy with what we have available now. And then this was really positive data, but it just hasn't been reflected in the FDA uses, but this could be something to watch out for in the future. And then lastly, this table just shows common dosing for carbapenems in patients with normal renal function. And that concludes this presentation. Thank you for listening. And then here are just all the references that I use.